7.2 Introduction. In this unit, we begin our exploration to some of the contemporary postmodern approaches to psychotherapy. In the previous unit you have learned about various popular but traditional psychotherapy with their theoretical and clinical orientation. In the current unit you will be learning about theories based on postmodern approaches like constructivism, social constructionism and feminism. Therapies based on family systems theory are also discussed in this unit, including therapy administered at the group level. Further, therapists may go for eclectic approaches in which they combine more than one approaches as per the client situation and requirement. Therefore, the knowledge of different therapy will broaden your vision to understand how therapies work effectively in different conditions and also why therapists use eclectic approach. The popular therapy that we are going to discuss in this unit are reality therapy, solution-focused therapy, narrative therapy, group therapy, multimodal therapy and others. Before we discuss these theories, let us understand what is postmodern approach in psychology. Almost all schools of psychology that emerged by following Wundt's experimental psychology are associated with modernism, which includes not just mainstream psychology but also humanist psychology. Modernism in psychology emphasizes the value of science and believes that the scientific methods can reveal the objective truth about human psychology and behavior. It accepts empiricism and it emphasizes on observation and experimentation in psychological investigation. Modernism in psychology places the individual at the center of its attention, and the individual mind becomes the subject matter of psychological investigation. In comparison, postmodernism emphasizes that there is no single truth. Here the epistemological base is social constructionism, which explains knowledge, truth, and meaning as a product of social construction. While modernist psychology has traditionally viewed language as a passive vehicle for our thoughts and emotions, postmodernism views language as more than just a means of expression. Furthermore, the postmodern approach claims some more different types of shifts in psychological practices: the move from individuals to relationships, the shift from an objective reality to a world of social construction, and the shift from empiricist technique to discourse analysis. Despite the apparent disparities between the two approaches, there are certain similar grounds on which we might combine them and move beyond their opposites. Now let us discuss each of the above-mentioned theories and related therapies. 7.3 Choice Theory. We are what our choices are. Think about your daily life: what to eat, what to wear for college or mall, or to a friend's house, what to do in the evening, how to spend time with family, how do you react when your helper at home does not turn up, or your child is sick, and so on. Every moment of our life, we make various choices. And these choices determine how we think and feel about our life. Our choices are internally motivated. Hence, understanding why we act the way we do is the key to understanding ourselves. Choice theory, given by William Glasser, helps us better understand and control our own behavior. It emphasizes on the underlying motivation of our behavior and actions. He differentiates between internal control psychology and external control psychology. According to external control psychology, our actions and reactions are influenced by what other people do or how they interact with us. Controlling our own behavior is achieved through the use of internal mechanisms. Glasser points out, when we control our thoughts, we control our actions. There are, of course, exceptions, such as when we are in a state of fear or panic, but we are largely in charge of our own actions. This does not mean that we are exempt from being responsible for our actions, but rather that we are given the opportunity to make a conscious choice about how we behave. Even if we cannot change the behavior of others, we can change our own outcomes by learning to better manage our thoughts, says Glasser. Key concepts of choice theory. The only thing we can give or receive from other people is information. The only person whose behavior we can influence is our own. Every action is a part of a larger whole. Glasser has given a term called total behavior, which is made up of 4 separate yet interrelated components that always happen at the same time. These are acting, thinking, feeling, and physiology. Glasser suggests we have considerable control or choice over acting and thinking, yet little ability to directly choose the feeling and physiology components, as they are more deeply subconscious and unconscious. These 4 components remain closely intertwined. The choices we make in our thinking and acting greatly affect our feeling and physiology. According to Glasser, all our actions are motivated by a set of 5 fundamental needs that evolved over time, and now these are embedded in our genetic structure. Our behavior is an expression of our desire to meet those needs. These are need for survival, physical security, love, the need for belongingness and connectedness, power, the need to feel competent and in control, fun, need for play, amusing oneself or novelty, freedom to make choices, being independent. For example, one person may have a strong need for love and belonging, but their partner may have a lower need for love and belonging but a high need for freedom. It is important to understand that everyone has a different profile or mixture of these needs. For example, going on a vacation with a loved one could fulfill your needs for love and belonging and freedom, fun, and belonging, or playing a sport can make you feel good at something, be enjoyable, and you may feel connected to your team. Pleasant worldviews or images in our minds can prompt us to act in a certain way if we believe that our reality does not meet these standards. If we picture love as someone providing us tea in bed every morning, it is possible that someone else does not see it that way at all. We use these mental images to compare our current situation to our ideal situation. In Glasser's view, our actions are made up of 4 components: our thoughts, actions, bodily sensations, and emotions. As we mentioned earlier, he refers to these 4 factors as our total behavior. These are like 4 wheels in total behavior: thinking, doing, feeling, and being. The way we feel can be changed by changing our thoughts and actions, he argues, because this affects our overall behavior. Even if it is just at a social event, you may start picturing what it would be like if your partner were to break up with you because he's attracted to someone else. You may experience increased sweating, a rise in blood pressure, and feelings of panic and anxiety as a result of this. If this is your behavior, you may be observing their every move with an unblinking gaze. Your body will feel calm and relaxed with a sense of enjoyment if you can change your thoughts to believe that you can rely on your partner. You could take this as an opportunity to shift your attention to the people around you and engage in a conversation with them. Ask yourself whether or not your overall behavior is leading you toward your true desires or away from them. Will your actions get you closer or further away from having a good relationship with your partner if you want one? What about your actions if there is no particular judgment or hierarchy of needs? Some behaviors that Glasser has identified as helpful or not helpful in getting closer to what we want are connecting habits. Glasser's theories provide an invitation to responsible behavior, which he believes leads people to lead happier and more satisfying lives, which include being supportive, encouraging, listening, accepting, trusting, respecting, and negotiating differences. Critiquing, blaming, complaining, nagging, threatening, punishing, bribing, or rewarding control are all examples of disengaging behaviors. Also, Glasser recommends a simple self-reflection activity to help you get what you want. What do I desire, and what am I doing to achieve it? We can see and try some different thoughts and actions and decide if they are more effective in getting us closer to a happier and more positive life. It can be empowering if we can begin to believe we can make active choices about our behavior and have the freedom to make different choices. We can train ourselves to think differently, and it gets easier with practice. There is a growing body of knowledge about how our thoughts shape the world around us. Self-awareness and control of your thoughts can help you achieve the life and relationship you desire. Glasser's 10 Axioms of Choice Theory. 1. The only person whose behavior we can control is our own. 2. All we can give another person is information. 3. All long-lasting psychological problems are relationship problems. 4. The problem relationship is always part of our present life. 5. What happened in the past has everything to do with what we are today, but we can only satisfy our basic needs right now and plan to continue satisfying them in the future. 6. We can only satisfy our needs by satisfying the pictures or specific wants in our quality world. 7. All we do is behave. 8. All behavior is total behavior and is made up of 4 components: acting, thinking, feeling, and physiology. 9. All total behavior is chosen, but we only have direct control over the acting and thinking components. We can only control our feeling and physiology indirectly through how we choose to act and think. 10. All total behavior is designated by verbs and named by the part that is the most recognizable. 7.3.1 Reality Therapy. Dr. William Glasser pioneered reality therapy in 1965, based on the concepts of choice theory. In this therapy, the basic premise is that a. All human problems arise when one or more of 5 fundamental psychological needs are not met and b. An individual can only control their own behavior. Parents and many professionals in the fields of education, mental health, and social services have accepted the fundamentals of this therapy. Glasser was of the opinion that achieving one's own objectives and wishes is easier when one focuses on changing one's own behavior rather than trying to influence the behavior of another. Reality therapy is based on the idea that everyone is always attempting to meet their basic requirements. Reality therapists believe that when a person is depressed, it is because one of the 5 needs has not been met. In reality therapy, it is argued that changing one's behavior can have a positive impact on one's feelings and on one's ability to achieve one's goals, so it is possible that those taking part in the therapy will learn how to be more aware of any negative thoughts and actions that may be preventing them from meeting their needs. It employs questions like, what are you doing and what can you do? Therapy may begin by helping an individual shift their emphasis away from their former habits and toward their current ones, so that they can begin to heal. The requirements that can be met in the present are the ones that are most important. As Glasser felt that signs of mental distress are caused by a person's isolation from others, reality therapists prefer not to focus on a person's symptoms. In reality therapy, patients are asked to analyze the impact of their behavior on a specific issue, which helps them focus on things they can alter instead of things beyond their control. In actual treatment, the focus is on what the patient can influence. Reality therapists think that by focusing on one's own needs and desires and coming up with a strategy to meet those needs without judging or blaming others, one can improve one's relationships. Steps of reality therapy in the BAPCH model. W. Explore basic wants. D. Find out what you are doing. E. Evaluate whether it is working. P. Formulate a new plan. In the reality therapy, therapists use BAPCH, wants, doing, evaluation, and planning, system which is demonstrated in above box, the reality therapist works with clients by focusing on all four step-by-step process in which therapist firstly explore clients' wants or desires and what clients are doing to accomplish those desires. In the second step, therapist assesses whether what clients are doing is beneficial or detrimental to their goals, and in the last two steps therapists eventually assist the client and make plan in developing strategies to change their behavior. Role of the therapist in reality therapy. Because reality therapy aims to help people who have trouble relating to others, establishing a rapport with the therapist is essential. In the opinion of reality therapists, this connection is the most critical factor in aiding healing. Once the therapeutic relationship is established, it can be used as a model for establishing satisfying relationships outside of it. Relationship building techniques learned during safe therapy sessions can be used to everyday life, making it easier for persons in therapy to expand on those techniques in the real world. Reality therapists believe that a person's ability to apply the skills they've learned in therapy to real-world situations increases their chances of having more satisfying relationships and a more rewarding life. Application of reality therapy. Reality therapy is widely accepted as an effective treatment for a wide range of conditions, but it can be particularly beneficial for children and young adults who are experiencing challenges in school and their communities. Teachers and school counselors who receive proper training in reality therapy report gains in classroom performance, increased cooperation, and fewer disruptive behaviors. Teen pregnancy, for example, has been found to benefit from the use of reality therapy in the treatment of behavioral difficulties. Reality therapy is based on the premise that in order to alter one's behavior, one must accept responsibility for one's actions. Sport coaching and juvenile offender programs that incorporate reality therapy have both seen success in changing the conduct of their participants. Concerns and limitations of reality therapy. Results of the previous researches related to reality therapy demonstrate that using reality therapy in schools to address behavioral issues has had excellent outcomes. Nevertheless, there has been very little long-term research into the efficacy of this therapy in school populations so far. These researches are restricted by the lack of experimental control in areas like sample size and training of teachers, and questions of voluntary involvement. While reality therapy has been shown to lessen concerns with target group misbehavior in schools, outcomes are limited in terms of its power to improve the personal experiences of children and young people, their self-esteem and self-conception. Research shows that reality therapy can help with symptoms of behavioral difficulties, but not the fundamental causes and reasons for those issues. 7.4 Feminist theory. Feminist theory not only acknowledges but also privileges the voices and experiences of people who have been marginalized by dominant cultures. In feminist therapy, the wisdom and know-how of those who spend their lives outside of the established power centers of a culture are recognized and respected rather than imposed on those who need help. When used to its full potential, this viewpoint has the potential to completely transform the way treatment is currently conducted. There are a number of different types of feminist therapy, for example, feminist postmodernism, feminist family therapy, feminist standpoint theory and feminism psychoanalysis are only a few of the many forms of feminism that exist. It is obvious that a feminist perspective can be taken on any therapeutic technique. According to Kotler and Montgomery, what all feminist therapies share in common are listed below. It is impossible to look at personal issues without considering their political and social background. When it comes to women's life, concepts such as freedom, independence, power, and choice have quite different connotations than when it comes to men's lives. Women's normative behavior has been pathologized in diagnostic manuals, offering labels such as dependent, passive, and compliant. In the past, women's virtues of listening and nurturing have been underappreciated. Postmodern, integrated models of feminist therapy have emerged from its origins as a largely female-focused therapy that sought to correct historical sexism. Instead of treating issues as diseases or problems that only the client has, the therapist and client examine jointly how the client's gender, social standing, and power affect his or her challenges. Women, men, children, families, and larger social systems are now all included in feminist therapy. Feminist multiculturalists have a pragmatic tendency in addition to criticizing many of the intellectual attitudes of the Western civilization. They stress the significance of tackling the practical difficulties that women, and children and men, of color face in most communities. The following are among them: intimate partner violence, sexual exploitation, the well-being of sexual and gender identity minorities, health issues among women, maternal mortality, and marginalized groups, HIV/AIDS, psychological perspectives on older women who have been traditionally ignored, disordered eating and body image as they relate to particular ethnicities, methodological and statistical issues in research with diverse samples, mental health of low-income women, women with disabilities, migrant workers, and immigrants/refugees. A closer look at the issues raised by this list reveals a focus on human rights and equality, not just for women but for everyone who has been oppressed. We have an obligation and responsibility to support those who have been most overlooked or marginalized, as well as to take a proactive position against forms of racism, ageism, sexism, and the maltreatment of anyone due to their qualities or views. 7.5 Constructivist and Social Constructionists Theories. Constructivists do not limit their study of human behavior to just the family. Instead, they look at society as a whole, including all of its interconnections. Because we are not only the product of our families, but also influenced by gender roles, media, cultural identity, language and the stories we have learned about ourselves and our origins. Walter Anderson's 1990 book, Reality is Not What It Used to Be, is one of the best attempts to explain a constructivist approach. Read the following conversation between baseball umpires, which is a commonly cited example in the literature: 3 baseball umpires chatting. A group of 3 baseball umpires are chatting about their approaches to their work after a game. There are balls, and there are strikes, and the first umpire says, "I call them as the way they are with authority and confidence." There are balls and strikes and I call them the way I see them, the second umpire mumbles as he frowns. There are balls and strikes, but they are nothing until I call them. The third umpire scoffs at both of his colleagues. In order to understand above example, firstly we should know the difference between a ball and a strike in baseball. A pitch is declared a strike if it travels over home plate and passes through the strike zone, regardless of whether the hitter swings at it or not. Whereas pitch is the act of throwing a baseball toward home plate to begin a play in baseball. If a pitch does not pass through the strike zone and the hitter does not swing at it, it is labeled a ball. An umpire, who is usually positioned behind the catcher, decides whether a pitch travels through the zone. With this background, when we see the view of the third umpire in the above example, he or she could be considered a revolutionary constructivist. He rejects the concept of objective reality altogether, except insofar as each individual's perspective on it differs. We can agree on a general strike zone based on operational criteria, but balls and strikes do not really exist as things. As a more moderate constructivist, the second umpire, too, sees balls and strikes as extensions of his own subjective experience. He also acknowledges, with humility and adaptability, that others may see things differently. In contrast, the first umpire is of the mindset that things like strikes and balls are real, and that everyone can agree on their definitions. Fundamentally, constructivist scholars and practitioners follow the same strategy as the second and third umpires. All knowledge must be viewed in the context of the individual's language and perceptions, according to the philosophy of this theory. When we take this approach, it keeps us flexible and humble, all of which are important qualities for therapists to have when working with clients. The social constructivist school of thought holds that people learn best when they work together in groups and are exposed to a variety of viewpoints and perspectives. According to social constructivism, an individual's understanding is shaped through the interactions with others. Lev Vygotsky, a Soviet psychologist, established the social constructivism theory. That knowledge does not originate from an objective reality, but rather comes from the mind's interpretations and recreations of events, is central to this idea. As a result, knowledge is a product of complex interactions between individuals and their surrounding environment. In this approach, 3 stages are involved in order to learn new information. In the first step of understanding a new topic by pulling different pieces of knowledge from a variety of sources is called construction. Storage is the second step, in which the act of storing new knowledge in the brain's long-term memory happens, and the last step is retrieving data from the memory and utilizing it. When it comes to retrieval, mistakes can easily be made. Reconstruction errors can be made by a learner. When there is a gap in one's comprehension, the result is a misinterpretation. The tendency is to fill in the gap with logical concepts that may be incorrectly conceived. When recovering information from long-term memory, a learner performs a reconstruction error in order to develop a logical but inaccurate thought. An individual constructivist approach to knowledge construction, known as constructivism, emphasizes the importance of a person's own experiences in the process of learning. Social constructivism, on the other hand, focuses on how social interactions influence the production of knowledge among learners. Rather than merely reflecting an external, objective reality, learning is viewed as an active process in both theories. They differ, however, in that individual constructivism emphasizes personal experiences, whereas social constructivism focuses on interpersonal relationships and exchanges. Both views are based on the recognition that people often interpret things in a variety of ways. Constructivism, or individual constructivism, on the other hand, emphasizes the importance of the individual's own life experiences in creating a subjective representation of knowledge. On the other hand, social interaction is a crucial element in the construction of knowledge in social constructivism. It is a tenet of social constructivism that people's knowledge evolves as they engage with one another and with their environment. At the end of the discussion, we can summarize that constructivists are interested in what goes on within people's mind or brains, but social constructionists are interested in what goes on between people as they work together to create realities. Guterman described these two perspectives. Although both constructivism and social constructionism endorse a subjectivist view of knowledge, the former emphasizes individuals' biological and cognitive processes, whereas the latter places knowledge in the domain of social interchange. Many authors have attempted to sum up the basic principles of constructivist and social constructivist thinking in terms of therapeutic practice. Solution-focused therapy, narrative therapy and relational cultural therapy come under these approaches. 7.5.1 Solution-focused therapy. Solution-focused therapy is also commonly known as solution-focused brief therapy, SFBT. The present form of this therapy has been originated in 1980s by the two scholars named Steve DeShazer and Bill Hanlon. Both of these scholars are influenced by Milton Erickson, who is popularly known to be a creator of brief therapy in the 1940s. Theorists and practitioners like Insoo Kim Berg and Michelle Weiner are also associated with this therapy. This therapy focuses on finding a solution to the problem and believe that therapy is most effective when a family's specific problem is resolved. Solution-focused therapists, on the other hand, focus almost solely on the positive outcomes of their clients' situations. The goal of the solution-focused therapy is to help the clients to identify their inner potentials and to point out expectation they have during their stressful situation, or in other words, when they are in distress. Further goal is to direct clients towards solution to situations which are already present in their expectations. Therefore, the focus of therapy is on the positives and possibilities which are there in present and future. Key concepts. Solution-focused therapy does not have any substantial views about human nature, although it believes that people might become stuck in unresolved past conflicts and inhibited if they focus on past or present problems rather than future solutions. Solution-focused therapy focuses on clients' health and strength. This therapy has some beliefs which are in line with Erickson's idea that talks about people having all the resources within themselves to deal with the problems even though they do not know the actual cause of the problem. Erickson also strongly believes that a little positive change in the individual's behavior has significant role in profound changes in problem context. The solution-focused therapy has an assumption that people really want to change and that change is inevitable. Role of therapist. The very first role of solution-focused therapist to identify how much client is active and committed for the process of change. Under the level of activeness and commitments towards change, clients usually fall into three categories, i.e. visitors, complainants and customers. Visitors are who are neither a part of the problem nor a part of the solution. Those who complain about situation as an observant without involving themselves in resolving them are considered complainants, and customers are those who are eager to work on finding solutions rather than just describing problems and how they are involved in them. For example, solution-focused counselors assist clients to access the resources and strengths they already have but have not been utilizing in order to facilitate change. They motivate, test, and set up standards for future change. They do not ask, why. When an issue arises, they are not interested in finding out how it got there. With the client, they are more concerned with finding a solution to the problem. For the most part, they let the client to be the expert in his or her own life. Techniques. Therapists who follow the solution-focused model, such as Steve DeShazer and Insoo Kim Berg, advocate for using solution talk as much as possible rather than problem talk. Clients' outlooks shift to a more positive one when they hear about possible future successes rather than the failures that characterize the present. Therapists, on the other hand, assist their clients in focusing on the exceptions to their problems. In other words, clients are reminded that they already have the ability to help themselves, as evidenced by the fact that they have already experienced some better moments or days. When a client assumes that their problems are always present, they are wrong. Similarly, even if clients frequently overlook their successes, they are not coincidence but rather the result of their own hard work. So, if a family reports that they have argued less recently than they did in the previous month, the solution-focused therapist takes note of this improvement and assumes that the family was responsible for it. In the last week, what did you do to improve things? Is there a way for you to keep doing the same things in the coming weeks? In solution-focused therapy, tasks and questions are used to draw attention away from problems and toward solutions. At the end of their first session, Solution-focused therapists often instruct their clients to write down aspects of their lives that they want to continue for the rest of the week. As a result, clients are compelled to pay attention to the good things in their lives rather than the bad. In addition to this, therapists ask exception questions like when something was not a problem for you and when present problem was not so bad in the past. Therapists ask miracle question, for example, if the problem is eliminated, how would your life be different? Another type of question therapists ask is called scaling questions, in which client has to rate on a scale of 1, low, to 10, high. For example, how terrible has the problem been in recent weeks? How much severe the problem is? Scaling helps client to understand their position for both things related to their present problem and where they have to move in order to achieve realistic goal. An additional intervention is to give clients compliments, written notes that praise clients' strengths and establish a yes set in them, i.e., a belief that they can resolve difficulties. Before a client is assigned a task or a project, compliments are common in practice. Since when has this issue been less problematic? During that moment, how did you make it better? Two more techniques are popular in solution-focused therapy, in which one is clues, hinting at a future in which certain habits will persist and not be a cause for concern for the clients, and another is skeleton keys, which are produced that have worked before and have some universal application in various problems. Strengths and limitations. Solution-focused therapy has become increasingly popular in recent years because of structured, positive-oriented to work with variety of clients, different questions and an emphasis on quickly resolving presenting problems. This therapy has gained enough research support for its effectiveness. The approach that we use in this therapy can also be combined with other therapeutic approach. Limitation of solution-focused therapy includes almost negligible attention to clients' history and also does not focus on insight. 7.5.2 Narrative therapy. Narrative theory can be considered as phenomenological in that it examines people's inner experiences. It is existential in the sense that it seeks personal meaning. It is language sensitive, similar to cognitive and Gestalt theories. It is frequently regarded as a feminist theory as well, because it examines how people are colonized and marginalized as a result of their gender and race. However, it also incorporates many of these ideas and modernizes them by categorizing them as postmodern. Michael White and David Epstein established the narrative therapy approach in the 1970s and 1980s, and it has subsequently been refined by others. The paradigm shift that therapists utilize to frame their job is frequently discussed in academic literature. The following is an example of such a transformation. Narrative therapy, which is also highly popular among contemporary family therapists, focuses on clients' inclinations to make meanings about themselves and events in their life in specific ways, which can lead to psychological issues. Narrative therapists believe that the stories we create about our own experiences have a powerful influence on how we experience new events, as the name implies. In some ways, we edit our experiences to match the narrative we've created. As a result, if we see ourselves as failures in our own lives, we are more prone to interpret occurrences in ways that fit that narrative. However, if we can rewrite our stories and recast ourselves as heroes, the same series of events could be seen in a more attractive light, and our self-esteem could improve. To have better understanding about narrative therapy, the following case study can be one of the way through which we can understand the procedural part of narrative therapy. As an example, consider Phil, a 29-year-old man who has been married for 6 years. Phil and his wife, Jamie, have a 4-year-old daughter and are expecting another child in a few months. The primary reason why Phil and Jamie seek therapy is Phil's depression, specifically, Both Phil and Jamie agree that Phil is extremely self-critical and dejected over career-related issues. Phil explains to Dr. Gupta, a narrative family therapist, that immediately after finishing college at age 22, he had taken an entry-level corporate job. Although he was quite capable and had advanced in the company, Phil found the work very unsatisfying and stifling. After discussing the matter at length with Jamie, at age 27 Phil decided to leave the corporate world and focus on his long-time passion, music. While Jamie continued to work full-time, Phil worked hard to establish himself as a guitarist/singer/songwriter, and he experienced quite a bit of success. He had regular gigs at numerous venues, had recorded several independent CDs that sold well locally, and had recently signed a contract with a record label. In spite of these successes and the satisfaction he derived from his music, Phil saw his career change as a mistake and an embarrassment. He made less money as a musician than he would in his corporate job, and some of his friends and relatives wondered why he would allow his career to go off track. Phil also felt that his old job had more stability and prestige and that he wasn't adequately fulfilling his role as a husband and father with his current occupation. Phil's negative feelings about his career decision had a significant impact on his self-image and his relationships with his wife and daughter, both of whom wished to see Phil happier. Dr. Gupta used the narrative approach to revise Phil's story from one of regret and failure to one of courage, authenticity, and success. If Phil's story had a title when therapy began, it might have been "I'm a Loser," and he found supporting evidence for this tale's theme in his decreased income and second-guessing friends and relatives. But Dr. Gupta offered another title, "A Self-Made Success," and supported it by pointing out that Phil had made a brave decision early in his career that enabled him to pursue his passion and that he had in fact been quite successful in a short time in a difficult business. Dr. Gupta argued that keeping the corporate job might have been the safe or predictable thing to do and may have fit with society's expectations, but Phil's actions showed an independence, self-awareness and determination that are remarkably admirable. With time, Phil began to see himself more heroically and was able to interpret life events accordingly. There are some similarities in the emphasis on influencing clients' interpretations of events between narrative therapy and cognitive therapy in various aspects. Changing these perceptions is like rewriting a story in narrative therapy, where they are considered as crucial components. In spite of its classification as a family treatment, narrative therapy places an emphasis on the individual client's struggle against repressive societal or cultural influences. 7.5.3 Relational Cultural Therapy, RCT. Relational Cultural Therapy, RCT, is another growing and popular technique which has philosophical roots in feminist approaches and has this trait within that it is relationally and culturally focused. RCT aims to reduce individual isolation while simultaneously increasing connections by encouraging growth, promoting relationships and reciprocal empathy among individuals. The fact that mainstream Western psychology theories generally depicted human development as a progression from dependence to independence was first brought to the attention of feminist psychologists several decades ago. According to what you have presumably learned in your developmental psychology textbooks, autonomy is frequently regarded as a sign of maturity. RCT, on the other hand, is based on the notion that, throughout their lives, human beings grow through relationships with others and that they require connections in order to prosper, if not simply to survive. According to the RCT, loneliness is a significant source of misery for people on a personal and cultural level. Similarly, the quality of a person's connections reflects the quality of his or her mental health. At the same time, relationships are what heal and enhance psychological well-being. Consequently, A primary purpose of therapy is to establish and maintain a mutually growth-promoting relationship in treatment and, ultimately, in the client's lives outside of therapy, as well. Such relationships provide what are referred to as the 5 good things. These are some examples. A desire to enter into further relationships as a result of how satisfying a positive relationship experience is, a sense of enthusiasm or vigor, an improved understanding of oneself as well as the other person in the relationship. In addition, there should be a desire to act both within and outside of the growth-fostering relationship. A general sense of greater self-esteem. In RCT, the central relational paradox, CRP, is also a fundamental principle. Assumed by the CRP, we all have a natural desire for relationships, and we crave for acceptance in these interactions. As a result, many of us believe that there are aspects of our personalities that are undesirable. Some of these have been attributed to social injustices like racism, classism, ageism, and homophobia. As a result, we prefer to keep them hidden and out of our personal relationships. As a result of the facets of ourselves we refuse to share with others, our relationships with others are less meaningful and validating than they may have been. Working with clients to identify and maintain relationships that offer chances for mutual growth and empathy is part of the RCT process. First, a strong, connected therapeutic relationship is formed because it serves as a model for similar partnerships. A high level of mutuality is promoted in this connection. In other words, the therapist rejects the role of a neutral authority figure and instead communicates to clients that they are important. The therapist also acknowledges, rather than downplays, the reality that she or he is important to the client. In an ideal world, both the client and the therapist recognize the value of expressing mutual empathy to another person through the process of connection. 7.6 Family Systems Theory. Individuals are not treated in isolation in family systems approaches. Systemic methods, on the other hand, acknowledge that symptoms emerge and are sustained in relationship contexts. For counseling to be most effective, the therapeutic focus should be one's primary system, which is usually the family. There are numerous techniques to working with families. When working with families, it is critical to abandon the assumption that the problem is central to an individual. Instead, problems are understood as being generated and sustained by and for the family. Regardless of how severe symptoms grow, family therapists recognize that all symptoms have a function. While other theoretical frameworks, for example, psychoanalytic and Adlerian, take the family into account when developing therapies, the premise that problems are core to the family and thus the family must be treated remains radical and novel by many standards. This purely systemic viewpoint emerged in the early 1950s and has since been developed upon by family therapy pioneers from many backgrounds. Family systems theory defines a family as a complex social system whose members impact each other's behavior. The family can be seen as a whole rather than as a collection of individuals. Any shift in one member of a family can have a ripple effect on the entire system, even if it does not directly affect the other members. However, Kerr and Bowen argue that focusing on the family as a whole may be more effective in changing children's behavior than targeting parents and children individually. According to family systems theory, the family has an important role in mental and physical well-being over the course of a person's life because most people have interaction with their family throughout their whole lives. It is common for families to have an impact on people's life on a day-to-day basis. It is argued in family systems theory that families are ever-evolving systems that are shaped over time by the shared rules, beliefs, and values of their members. Family system paradigm encourages mental health providers to not only treat the individual with mental health issues, but also to recognize the multiple subsystems within a family that highlight familial connections. What brings individuals together and drives them apart is influenced by family dynamics, for example, structures, roles, communication patterns, boundaries, and power relations, as well as any conflict or intergenerational transfer. It is possible for a family's functions to change over time. Some examples include providing daily care for a family member with a disability, participating in the community and advocating for others, providing economic support or guidance for any members, and providing spiritual and social encouragement. Behavioral exchanges between members of a family are the primary subject of the family systems theory. According to this view, problematic and non-problematic behaviors are created, maintained, and perpetuated by patterns of interrelationships among family members. Reconstructive behavioral exchanges between family members are the goal of family system theory, which is not pathology-oriented. When addressing problem behavior, it is critical to pinpoint and break up habitual patterns of behavioral exchanges. When these problem-perpetuating patterns are successfully terminated, the problem behavior disappears and the treatment is complete. Therapies based on family system theory or approach like family therapy, couple therapy and interpersonal psychotherapy have been discussed in further sections. 7.6.1 Family therapy. In the mid-1900s, the family therapy movement was considered groundbreaking. Many people looked up to its founders since they were perceived as mavericks for coming up with a novel approach to understanding and treating psychological disorders. Furthermore, they challenged the generally held belief that psychological symptoms stem solely from an individual's thoughts. As a result, they assumed that their clients' mental health issues were a result of the dysfunctional families in which they were raised. The problem was not confined to a single person, rather, it was a systemic issue. Early family therapists used this basic yet deep notion to open up a new type of treatment in which the family members worked together with the therapist to enhance their interactions, which in turn strengthened the mental health of every one of them. The systems approach, in which the whole is more than the sum of its parts, was really adapted by family therapists from philosophers and scientists. It is believed that circular causality provides a more comprehensive explanation for psychological difficulties than linear causality. Family therapy, like individual therapy, typically begins with a comprehensive evaluation of the family's functioning. There's no end to the diagnostic procedure in therapy. Depending on the therapist's approach to family therapy, assessment procedures may focus on such problems as describing the current problem, understanding family members' ideas about its causes, and valuing the family's relationships. Identifying the family members is an essential first step in appraising a household. Families can be organized in a variety of ways depending on the culture. It is not uncommon for some clients to have several relatives who are not actually connected, but who yet operate as family. The genogram is a useful tool for gaining insight into the structure and dynamics of a family. It is a pencil and paper way of putting together a family tree that includes at least 3 generations of links among family members. Understanding the essential concepts of family therapy. There have been swings of different approaches to family therapy devised and put into action. Individual therapy approaches such as psychodynamic, humanistic existential, behavioral, and cognitive have all been successfully used in family settings as well as in individual treatment settings in the past. This large spectrum of forms is divided into 3 broad categories by Griffin, historical styles, that place an emphasis on the present and downplay the importance of the past, most common in contemporary clinical psychology. Historical styles emphasize family history and typically longer duration than a historical styles, including Bowenian /intergenerational family therapy and psychodynamic approaches. Experimental styles methods that emphasize personal growth and emotional experience both in and out of sessions, including the approaches of Carl Whitaker and Virginia Satir. Classic concepts. Family structure. Every family is governed by a set of established norms. Even though these norms are rarely stated explicitly, they have a significant impact on the behavior of family members. Families are made up of rules. These rules are known as the family structure, and if any of these rules are broken, it can cause issues in the relationships between family members and can lead to psychological symptoms in some members. Structural family therapy, popularized by Salvador Minuchin and others, focuses on changing the family's structure in order to better serve its members' needs. When working with families, structural family therapists highlight the importance of subsystems and the boundaries between them, parental subsystems, sibling subsystems, and so on. Emotional connection between family members should be allowed, but the boundaries should be firm enough to allow for individuality. Family members might become entangled if boundaries are too loose, or disengaged if they are too tight. Structural therapy focuses on identifying and correcting and clarifying family rules, generally with an emphasis on building a clear hierarchy of authority in the family. Families, like any other type of organization, such as a business or the military, function best when their organizational structure is well defined and logical. Self-differentiation. Murray Bowen and his adherents believe that each family member has a main responsibility to exercise a degree of self-determination. This means that in a healthy family, everyone is free to develop their own unique personality without compromising their emotional ties to the rest of the family. Families, on the other hand, often have issues with this, leading to members who are overly emotionally linked to one another. In other words, the members of these families are not able to separate themselves from one another emotionally. If one member of a family has an opinion or sentiment, the entire family has an opinion or feeling as well. It is important to recognize that this family has a lack of distinction, and to analyze the circumstances that may have generated or are now maintaining it, and to develop connections that are less fusion-oriented and more independent. Triangles. Bringing in a third party can be a strategy used by both parties in a dispute when they are unable to come to an agreement themselves. Attorneys use this tendency to support their cases in court by calling on experts to testify. An analogous procedure can take place within families, although it can cause considerable issues, particularly for the one who is being forced into the triangle. Parents who are at loggerheads often use their children to enlist the help of a third party to form a triangle. Parental attempts to triangulate can put children in a psychologically harmful dilemma where they believe that they must choose sides with one parent against the other, unlike an expert witness in a court case. Even in households where there is no dramatic divorce or child custody struggle, negative impacts can arise when parents covertly encourage their children to side with them. Family therapists typically aim to expose the family's triangulation tendencies and encourage the persons involved in the disagreement to deal with one another directly rather than engaging third parties such as their children. 7.6.2 Couple therapy. Conflict in a marriage or long-term relationship does not mean the relationship is bound to fail. In reality, working with a marriage and family therapist to improve the love relationship, re-establish trust, and boost the possibility of real intimacy may be a wonderful opportunity for couples. A new relationship, a new child in the family, dealing with the death of a grandparent, or the end of a partnership are all occasions when couples and their families are more prone to experience difficulties in their romantic relationships. A marriage and family therapist can provide impartial support and information on love relationships, regardless of whether you expect to save your marriage or plan for a divorce. Here, let us examine the nature and concept of couple therapy, and then discuss various approaches to couple therapy. Nature and definition of couple therapy. There is a lot of overlap between couples therapy, marriage counseling, and marital therapy. Different labels have been given to the same process, and the differences frequently stem from the psychologist's preference for a certain psychotherapy philosophy. Couples therapy focuses on issues that arise in a couple's interaction. Relationship troubles, on the other hand, are invariably accompanied with individual symptoms and problems. For instance, if you and your partner are continuously arguing, you are likely to be nervous, angry, or depressed on a long-term basis, or all three. Alternatively, if you have a hard time managing your temper, you and your partner will get into more fights. During couple therapy, the psychologist will assist you and your spouse in identifying the sources of tension in your relationship and helping you decide what adjustments need to be made to the relationship and to each other's behaviors so that you may both be happy in it. Changes in communication styles within a relationship or changes in a person's mental health could be the cause of these alterations. Learning to speak better and to listen more attentively are two of the main goals of couples counseling. As a couple, it is imperative that you learn how not to compete with one another, as well as discover similar life goals and how to divide up household duties. Individual psychotherapy, mediation, and educational approach are all examples of the various forms used as the therapy. Effectiveness is achieved by combining these three elements. Approaches to couple therapy. Couples therapy can be approached from a variety of angles, and the therapist is free to adopt any or all of these approaches. There are a number of approaches to marriage therapy, but the psychodynamic model is among the oldest and most often used. Personal history and underlying motivations of each client play a critical role in this approach of counseling. They may work with one or both spouses separately, or with another therapist who also treats the other, employing psychoanalytic ideas to guide their therapy plans. Psychodynamic therapy and couple counseling. Psychodynamic therapy is based on a well-developed and complex theory of human development and interaction that is the oldest of current therapies. An insight-oriented approach, psychodynamic therapy focuses on the unconscious emotions that show themselves in behavior. Couples counseling can benefit from this method, which attempts to uncover emotions that appear in behavior, focuses on each client's unique circumstance, and takes into account how prior relationship experiences influence current relationships. One of the primary objectives of psychodynamic therapy is for the client to become more self-conscious and aware of how their past experiences can influence their current behavior. It can assist in resolving old disputes and problems stemming from failed romantic relationships. Freud's psychoanalytical method is the inspiration for this technique. There are multiple levels of consciousness in the human mind, according to Freud, and the unconscious holds memories from our history. He was of the opinion that even long-forgotten events might have an impact on how we act today. He created a mechanism to bring memories and associations to the surface so that they might be studied to change one's behavior. Acceptance, empathy and understanding are the cornerstones of the therapeutic connection in psychodynamic counseling, with an emphasis on building a trusting working alliance. This friendship fosters healing by providing a sense of security. Systems approach and couple counseling. A systems approach to marriage counseling emphasizes the interplay between partners rather than their actions or personalities as the source of marital troubles. Interlocking roles of the marriage or members of the family are analyzed through behavior and communication patterns. It is possible that family members have been socialized to play roles like scapegoat, caretaker, or even clown. Even while it may appear that only one member of a family is having problems, a closer look reveals that the problems are actually a symptom of a dysfunctional pattern in which everyone is actively involved. Short-term therapy and long-term therapy are both options in systems therapy, which is a broad phrase that encompasses many different types of treatment approaches. Client-centered therapy. A common individual treatment style also utilized in marriage counseling is Rogerian or client-centered therapy, also referred to as humanistic therapy. There is a strong emphasis on openness and communication in this setting. Couples work together to improve their communication and listening skills, as well as their ability for emotional honesty, through a series of specifically designed exercises. Behavioral approach. Using a behavioral approach, which views marital issues as aberrant behaviors that can be monitored and changed, is another popular method to marriage counseling. Recording one another's actions helps couples become aware of their own damaging behavior patterns. The therapist then instructs them in a variety of behavior modification techniques in an effort to foster more satisfying, mutually reinforcing relationships. Behavioral therapy also aims to improve a couple's ability to solve problems and resolve conflicts. In other cases, a marriage counselor may treat both couples at the same time, but only one at a time, while another therapist handles the other. Couples are increasingly being counseled by two therapists working together, with married therapists sometimes working as a group. In theory, the co-therapist's partnership should serve as a role model for their clients. When couples seek marriage counseling in a group, they benefit from the same benefits that group therapy provides individuals. 7.6.3 Interpersonal Psychotherapy, IPT. Interpersonal psychotherapy, IPT, is a brief, concentrated, and evidence-based treatment strategy to deal with mental disorders. IPT's primary objective is to assist clients enhance the quality of their interpersonal relationships and social functioning in order to alleviate their distress. Gerald Clareman and Myrna Weissman developed IPT in the 1970s, taking inspiration from the work of Harry Stack Sullivan, Adolph Meyer, and John Bowlby. Interpersonal psychotherapy, IPT, is an approach to dealing with mental health difficulties that is structured in a unique way. Attachment and communication theories serve as the basis of IPT, which aims to assist individuals deal with their current issues and enhance their interpersonal connections. IPT gives techniques for resolving issues in four critical areas. Firstly, it addresses interpersonal weaknesses, such as social isolation or participation in unsatisfying relationships. Second, it can assist patients in coping with unresolved grief, if the onset of sadness is related to the recent or past death of a loved one. Thirdly, IPT can assist those going through difficult life transitions such as retirement, divorce, or relocating to a new place. Fourth, IPT is indicated for resolving interpersonal conflicts that arise when partners, family members, close friends, or employees have divergent expectations. When it's used, IPT was initially created to treat patients suffering from major depressive disorder. Additionally, it is beneficial in the treatment of eating disorders, postpartum depression, drug and alcohol addiction, dysthymia, and other mood disorders, including bipolar disorder. IPT is distinct from other classic psychodynamic techniques in that it focuses on current relationships rather than past ones and acknowledges, but does not dwell on internal tensions. The technique is distinct from cognitive and behavioral therapies in that it focuses exclusively on dysfunctional beliefs and behaviors in interpersonal relationships. IPT tries to alter relationship patterns rather than the depressive symptoms associated with them, as well as to address relationship challenges that worsen these symptoms. IPT is less directive than cognitive behavioral techniques, concentrating on the patient's specific target areas rather than on his or her personality characteristics. What to expect? Individual therapy sessions or group work are typically done in 12 to 16 weeks as part of IPT treatment. Treatment is planned, and it includes homework, constant assessment, and therapist interviews. The initial phase of IPT typically consists of 1 to 3 sessions in which the therapist assesses depressed symptoms as well as social history and close connections, including any changes in relationship patterns and expectations. The therapist then collaborates with the patient to design treatment plans tailored to any identified problem areas. A focused issue area may alter as treatment develops. Similarly, the therapist's suggested tactics could be effective. Individual and group sessions are both time-limited, semi-structured, and focused on interpersonal dynamics. Groups give patients greater opportunities to practice interpersonal skills in a secure, supportive atmosphere. Individual meetings to review goals, methods, and progress are common in group therapy before, during, and after treatment. How it works. For more than 20 years, IPT has been used as a time-structured treatment for severe depressive disorder. For practitioners, the social environment is a major element in the development of depression and its subsequent persistence. Since its conception, IPT has been adapted to treat adolescents and the elderly. A study on the effectiveness of antidepressants indicated that IPT was as effective as the medicine. About IPT therapist. As a research intervention, IPT is a relatively new form of psychotherapy, and until recently, the majority of IPT's practitioners were also researchers. Despite the fact that IPT's research success has led to its inclusion in clinical treatment guidelines and increased interest among doctors, criteria for clinical training for those who are not researchers are still being developed. An international umbrella organization, the International Society for Interpersonal Psychotherapy, ISIPT, is responsible for discussing training concerns and allowing countries to build their own credentialing procedures for IPT. A therapist should assist the patient in identifying and prioritizing any interpersonal difficulties he or she wishes to address. In addition, the therapist should provide assistance in resolving concerns, analyze communication, and listen respectfully. 7.7 Group therapy. A small group of clients is treated by one or more therapists in the context of group psychotherapy or group therapy. Although the term may be used to describe any type of psychotherapy that is delivered in a group format, for example cognitive behavioral therapy or interpersonal therapy, it is most commonly used to describe psychodynamic psychotherapy in which interpersonal relationships are developed, explored, and examined as a mechanism of change. Psychoeducational and skill training groups, such as those for anger management, mindfulness, relaxation, or social skills training, and support groups all fall within the broader definition of group therapy. Montgomery discusses the contrasts between psychodynamic, activity, support, problem solving, and psychoeducational groups. Nonverbal expressive therapies such as dance therapy, music therapy, or the Tarkana rhythm process can also be used in group therapy. The most evident distinction between group and individual therapy is the number of people in the room with the psychologist. Originally, group therapy was employed to save money in institutions where there were too many clients and too few psychologists. However, scientists found that the group experience benefited people in ways that individual psychotherapy may not always address. Likewise, some may not get benefit from group therapy. Group psychotherapy is designed to assist in the resolution of emotional issues and to promote personal growth. The therapist, leader, conductor, or facilitator selects group members who can benefit from this type of treatment and who can influence other group members. Joseph H. Pratt, Trigant Burrow, and Paul Skilder were among the early American pioneers of group psychotherapy. Jacob L. Moreno, Samuel Slavson, Hyman Sputnitz, Irvin Yalom, and Lou Ormond created group psychotherapy after World War II. The famous publication The Theory and Practice of Group Psychotherapy by Yalom, who pioneered group psychotherapy in the United States, has had a significant impact on the field around the world. Psychodrama was established by Moreno and is a highly structured type of group therapy. Yalom's therapeutic, originally curative, variables come from substantial self-report study with group therapy users. Universality, recognizing similar experiences and sentiments among group members as general or universal human concerns, relieves alienation, validates experiences, and boosts self-esteem. Altruism, being able to help another person can boost one's self-esteem and help develop more adaptable coping techniques and interpersonal skills. Instilling hope, a member can be inspired and encouraged by another member who has overcome the issues they are still facing. Imparting information, as a non-therapeutic approach, members often express that they have found it quite beneficial to acquire facts from other members in the community when it comes to their treatment or access to services, for instance. Corrective recapitulation of the primary family experience, in a process known as transference. Individuals of a group therapy session may unwittingly associate the therapist and other group members with their own parents and siblings. To prevent unintentionally replicating unhealthy patterns of interaction from the past, group members can benefit from the interpretations of the therapist. This will allow them to better understand how their early experiences have shaped their personalities and present-day interactions. Development of socializing techniques. In the group context, individuals are encouraged to take chances by expanding their repertoire of interpersonal behaviors and strengthening their social skills in order to build confidence. Imitative behavior. Group members can learn social skills by imitating the therapist and their fellow group members through a modeling process. As an illustration, consider expressing one's emotions, demonstrating care, and offering assistance to others. Cohesiveness. According to some, this is the main therapeutic component from which all others flow. Personal development can only occur in a social context for humans, who are herd animals with an innate need to be part of a community. In order for a group to be cohesive, all members must feel like they are part of the group, accepted, and validated. Existential factors. Catharsis. Emotional distress can be relieved by the expression of one's feelings without restraint. It is possible to alleviate shame and guilt when members share their stories to a receptive audience. Interpersonal learning. Members of a group learn about themselves by engaging with other members of the group and receiving feedback on their behavior and how it affects others. Self-understanding. In terms of interpersonal learning, self-knowledge is a bit of an overlap, but it refers to a deeper understanding of one's own difficulties and the motivations that drive one's behavior. Settings. A psychiatric inpatient unit's therapeutic environment may include group therapy. Additionally, group therapy in an institutional context might involve expressive treatments such as drama therapy, psychodrama, art therapy, and nonverbal therapies like music therapy in addition to the traditional talking therapy. In milieu therapy, in a therapeutic community, group psychotherapy is an important part of the treatment. Every interaction and activity is viewed as potentially therapeutic and is open to analysis and interpretation in daily or weekly community meetings, which serve as a medium for therapy in its totality. As many as 6 to 10 people meet with a qualified group therapist face-to-face in group therapy. Members of the group determine what they wish to discuss during the meeting time. Members are urged to share their thoughts and ideas with one another. Give your thoughts and views on what someone says or does by providing feedback. Each person has the opportunity to experiment with various ways of behaving and learn about how they connect with others through group interaction, which is highly encouraged. It is a safe place where members try to build trust so that they can chat openly and honestly about their personal lives. Members of a support group make a commitment pledging their loyalty to the group and agreeing to keep the information they share in private during meetings. Members of a group must not reveal information about the group's activities to a third party. Therapy groups. Homogeneous or heterogeneous therapy groups are possible. When a group is homogeneous, all its members have the same set of diagnoses. For example, they may all suffer depression. Individuals with a wide range of emotional difficulties make heterogeneous groups. The average group size is between 5 and 12 people. How therapy groups work. This depends on the group's makeup, aims, and setting. Some are time-limited, with a set number of sessions known in advance. Others are indefinite, with the group and /or therapist deciding when to end. Membership may be closed or open. The group's focus and the therapist's orientation determine the therapeutic strategy. In group therapy, members are encouraged to express their difficulties honestly. The therapist strives to foster an atmosphere of trust and acceptance among the group. Ground rules may include keeping group conversations private and limiting social contact between members. The therapist assists individuals in self-discovery while facilitating the group process. Sessions might be highly structured or unstructured and undirected, depending on the group's goals and the therapist's orientation. The leader usually steers a midway course, giving direction as needed but allowing members define their own agenda. The therapist can help the group by reinforcing favorable behaviors. Example, a member showing empathy and sympathetic listening to another is complimented and explained to the group. Almost always, the therapist would emphasize the members' commonalities to foster a feeling of group identification. Groups like Alcoholics Anonymous and Weight Watchers do not fall under the purview of psychiatric services like psychotherapy. Similar to group therapy, which provides social support, the ability to identify with others, and the sensation of belonging, these organizations give many of these same benefits to its members. Self-help groups also meet to help each other cope with their shared problem. Most of the time, these groups do not have a designated leader and instead rely on one or more members to act as the group's point person. To supplement psychotherapy groups, self-help groups may be appropriate. Termination of therapy groups. Group therapy can end in many ways. Some, like those in drug rehab centers and psychiatric hospitals, are ongoing as patients enter and exit. Others may start with an end date. Others may go on until the group or therapist feels the goals have been met. Some members may feel grief, loss, abandonment, resentment, or rejection when a long-term treatment group ends. The therapist encourages exploration of feelings and use of newly gained coping methods to deal with them. Working through this period is critical to the therapeutic process. Effectiveness. Group and individual psychotherapy have been demonstrated to benefit around 85% of patients. Patients should depart with a greater self-understanding, interpersonal and coping abilities. After the group disbands, some people continue counseling independently or in another group. 7.8 Multimodal therapy. Psychotherapy approaches such as cognitive behavioral therapy, person-centered or humanistic psychotherapy, hypnotherapy, and psychoanalysis are all well known to the majority of the population. However, few individuals are aware that there are already several hundred different types of psychological therapies available. Fewer still, including most therapists, ironically, are aware of the existence since the 1980s of a full and integrated system of psychological therapy that is undoubtedly the most elegant, thorough, and effective therapeutic method to date. Professor Arnold Lazarus developed the concept of multimodal therapy, MMT, which is now widely used. As a result, Lazarus hypothesized that most psychological problems have multiple dimensions, are determined by multiple factors, and are multilayered, and that comprehensive therapy necessitates a careful assessment of 7 reciprocally transactional dimensions or modalities in which individuals operate: behavior, affect, emotion, sensing, imagery, cognition, interpersonal relationships, and biological processes. When Arnold Lazarus was a graduate student at the University of Witwatersrand in Johannesburg, South Africa, he made significant contributions to the development of behavior therapy. This was in the 1950s, BT. In 1958, he was the first person to use the phrase professional literature, which was coined by him. During the 1960s and 1970s, he pioneered cognitive behavioral therapy, CBT, which he published in 1971 in the book Behavior Therapy and Beyond. Lazarus developed multimodal therapy in the 1980s, which is a complete, biopsychosocial approach to psychiatric assessment as well as theoretically consistent, technically eclectic psychotherapy that is technically eclectic. When Lazarus saw that there were significant treatment omissions in BT and CBT, he developed MMT as a result of his belief that these treatments were too limiting and narrow. MMT therefore analyzes more than just behavior, cognition, and affect. It also assesses imagery, sensation, interpersonal interactions, and biological elements. This results in a 7-point assessment framework known as the BAPCH ID: behavioral, cognitive, and emotional development. Because psychotropic drugs are the most commonly used biological intervention, the first letters of the 7 modalities can be combined to form the convenient acronym BAPCH I.D. Although the D modality represents the complete range of physiological and biological factors other than the use of substances, whether prescribed or not, the acronym BAPCH I.D can be used to refer to the 7 modalities. As a result, as previously stated, the BAPCH ID relates to BAPCH ID. Behavior, our actions; affect, our emotions; sensation, our senses; imagery, our ability to visualize, imagine, and think in pictures; cognition, our language-based thinking; interpersonal relationships, our intimate connections and other social involvements; drugs, our physical bodies, health behaviors, and medical matters. MMT is based on social and cognitive learning theory and treats reaction deficits and excesses within and across the BAPCH ID. As a result, multimodal therapists choose empirically validated and evidence-based procedures over theoretical integration, i.e., trying to mix together often contradictory theories of psychology, while utilizing effective strategies from a variety of methodologies. While it can be applied in treatment, the BAPCH ID notion can also serve as a model of human personality and experience in its own way. Individuals' uniqueness is reflected in basic ID, which represents their basic identity. Furthermore, while everyone has a basic ID, no two persons will have the same psychological experiences, prompting the need for individually designed psychological therapy. In addition, due of its breadth and emphasis on technical eclecticism, MMT may subsume the majority of other therapeutic approaches, for example, classical CBT, DBT, ACT, EMDR, mindfulness, and so on, whereas the opposite is not possible with other therapeutic approaches. But one of the most potent aspects of MMT transcends basic diagnostic labeling and allows for highly personalized therapy. Many individuals with the same diagnosis have very distinct symptoms, which necessitates a variety of treatment methods. Insomnia, rage, agitation, loss of appetite, anxiety, lack of ambition, ruminating on the negative aspects of one's life, and social withdrawal are all symptoms of serious depression. Other people may characterize hypersomnia, i.e., sleeping too much, weariness, difficulty concentrating, feelings of shame and worthlessness and suicidal thoughts as symptoms of depression. Despite the fact that they have the same formal diagnosis, it is obvious that the treatment needs of these two individuals will be vastly different. Furthermore, because MMT's goal is to identify and treat specific problems inside and across a person's basic ID, it is perfectly equipped to tailor therapy to each individual's specific needs, regardless of their diagnosis. Because everyone has a basic ID, practically any healthcare provider can use the MMT approach, regardless of theoretical inclination. Psychological therapy has never been more elegant or complete than MMT, which is founded on a wide range of studies. The model of personality and the paradigm for comprehending the universal yet unique characteristics of human psychology are also included. Arnold Lazaros earned the first Psyche Award in 1996, one of many distinctions and achievements he has earned over his long and successful career. 7.9 Let us sum up. Now that we have come to the end of this unit, let us list all the major points that we have already learnt. We started the discussion in this unit with the glasses choice theory, which is the outline of reality therapy. Constructivist and social constructionists' theories were also discussed and differentiated. Constructivists are interested in what goes on within people's mind or brains, but social constructionists are interested in what goes on between people as they work together to create realities. Then family system theory was explained as individuals are not treated in isolation in family systems approaches. Systemic methods, on the other hand, acknowledge that symptoms emerge and are sustained in relationship contexts. Further, present unit covered different therapy like family therapy, solution-focused therapy, narrative therapy, couple therapy and its different approaches, especially psychodynamic, systems, behavioral and client-center approaches. In the last section of this unit we focused on relational cultural therapy, RCT, multimodal therapy, interpersonal psychotherapy, IPT, and group therapy. All of the above therapy are very useful in current time as psychologists are using these therapies in different settings very frequently.